पता नहीं अब कितने दिन तक मैं काम पे नहीं जाऊंगी, लेकिन जब तक पापा ठीक नहीं हो जाते तब तक मैं काम पे नहीं जाने वाली हूँ। मुझे ही सुबह से शाम तक इनको देखना पड़ता है, इंजेक्शंस देना पड़ता है, बहुत सारी दवाइयाँ हैं, उनके बोन्स के लिए देना पड़ता है क्योंकि बोन एकदम वीक हो जाता है, उसकी वजह से उनके लिए वो दवाई देना पड़ता है। अभी उनके आंखें भी ख़राब हो गए, हिज लेफ्ट आई इज़ टोटली ज़ीरो, उसमें वो देख ही नहीं पाएंगे। सब एक से एक बार किडनी का प्रॉब्लम आ गया तो सब प्रॉब्लम आते जा रहा है अभी।
जब पता चला तो मुझे ज़रा फील हुआ, शादी होके एक साल भी नहीं हुआ था हम लोगों का, तो पता चला 7-8 महीने में पता चला मुझे कि ऐसा हो गया है प्रॉब्लम। हमेशा कुछ ना कुछ प्रॉब्लम रहता है, हम लोग के घर वालों को भी कुछ ना कुछ टेंशन रहता है एक्चुअली, कि कभी क्या हो जाता है बता नहीं सकते हम लोग। अभी 5 मिनट में हम लोग अगर नॉर्मल लेंगे तो 5 मिनट के बाद कुछ ना कुछ तकलीफ़ हो जाती है। अभी मेरे तो एज तो 24 ईयर्स है, उतनी भी बड़ी नहीं हूँ कि मैं क्या ऐसा लगता है कि ठीक है, तो तभी ऐसा लग रहा था मुझे कि इतना छोटी हूँ फिर भी ऐसा हो गया।
मैं केएम में गया तो उधर पता चला कि किडनी दोनों ख़राब हो गए। तो मेरा इतना कंडीशन ख़राब था कि 2 आदमी मेरे को पकड़ के लेके जा सकते थे और लेके आ सकते, रिक्शा में डाल के लेके जाते थे। मैं भी बहुत सोचता था मेरा ये सब का कुछ नहीं हुआ, मेरा ही होगा, ऐसा करके बहुत डिप्रेशन में था मैं।
मेरे को डायबिटीज़ जुना था 12-15 साल। आई वॉज नॉट एबल टू एनी डायग्नोसिस फॉर दैट। ये होने के बाद तो एब्सोल्युटली आई वॉज लाइक इन ए प्रिजन। इन बिटवीन आई वॉज थिंकिंग कि आई विल गो नाउ, आई विल नॉट बी बिफोर डायलिसिस, आई विल नॉट बी नो मोर फॉर द few months only.
The kidneys in our body are of the size of a fist, and when these small organs fail, it creates havoc in the body. Patients will have symptoms like vomiting, severe swelling of the feet, they can develop high blood pressure and eventually fall short of breath and may eventually die if they do not avail of any treatment. The 2 commonest reasons for kidney disease in our country, just like Western countries, is diabetes and high blood pressure. It's important to note that in India, 90% of patients who suffer from kidney failure do not avail of any medical treatment at all.
जब मैंने सुना भारत में 90% ऑफ द किडनी फेलियर पेशेंट को अच्छा ट्रीटमेंट नहीं मिल रहा है, I was so shocked.
India is already declared as the diabetes capital of the world. And very soon, because diabetes and hypertension are the 2 commonest causes of chronic kidney disease, India will have a large number of patients who develop chronic kidney disease because of these 2 problems.
So I asked the doctors, what is best we can do for the kidney patients in the society?
Depending on the stage of chronic kidney disease, patients can avail of treatment which includes conservative treatment, which is medicines. When their kidneys reach a stage where they are not functioning and functioning less than 10%, they require either dialysis or a kidney transplant. And when I say dialysis, it has to be a good quality dialysis to keep them alive for a longer time and really have a good quality of life.
So I asked Dr. Kothari, what is the value of the high quality of the dialysis?
Even the 10% who take treatment, if they do not get good quality treatment and good quality dialysis, they will eventually succumb to this disease because of inappropriate and inadequate treatment. Hence, it is important that they have a very good quality of dialysis so that they can have an excellent quality of life in the long term to have a complete holistic improvement in their health, emotionally, socially and physically.
I decided that we should create high quality dialysis center in India.
What you see behind me is Apex Kidney Care, which assures highest quality standards for dialysis patients. As you are aware of, that the dialysis patients have been increasing. What they need is a good quality support. Apex stands for highest technical support. We have machineries which are imported. We have technical support in the form of good technicians. We have a latest modern RO plant which assures very pure quality water, and that is all making the difference in someone's health.
Apex Kidney Care provides dialysis services to those diagnosed with chronic kidney failure in multiple centers in Mumbai. We are the only independent provider of dialysis services with an installed capacity of 45 stations. At every Apex Kidney Care Center, you will find in-center hemodialysis, in-center peritoneal dialysis units, diagnostics and rehabilitation services, radiology and sonography facilities, in-center nocturnal dialysis programs where patients undergo dialysis in the center while they sleep, and regular health and nutrition education programs for patients and families. Technology advances rapidly. Dialysis is no exception. At Apex Kidney Care, we have top-of-the-line Fresenius 4008S machines with automatic blood pressure recording, blood volume measurements and online clearance monitoring. All these are monitored and documented using TDMS, an online databasing and monitoring software. It is the first of its kind in India. The TDMS software makes it possible for the caregivers to monitor minute details of patients' progress and identify timely interventions to achieve the best possible clinical outcomes. After each session, the dialyzer is thoroughly cleaned and reprocessed. This is done using the Renetron system. Good dialysis requires pure water. In addition to a triple filtration system, we use ultraviolet light to kill bacteria. A microfilter or ultrafiltrate procedure eliminates any residual germs. The ultra-pure water is then transported through special moldable pipes to prevent stagnation and accumulation of bacteria. Apex Kidney Care provides ultra-pure water to achieve high-quality dialysis.
Quality of dialysis depends on two things, man and machine, and Apex looks very closely at both these aspects to make this a highly cost-effective as well as a very efficient service.
Balancing work, family and dialysis can be a challenge. The healthcare team at your Apex Kidney Care Center will work with you to schedule the most convenient time for your treatments. At Apex Kidney Care, we continually listen to our patients, understand their needs, anticipate problems and provide them a service beyond their expectations.
एपेक्स में आने के बाद में इतना फ़र्क गिरा है कि यहाँ पे सबको पता है कि मेरे डैडी अनकॉन्शियस थे, सबको एक मिरेकल लग रहा है कि वो चल के यहाँ पे अभी आ रहे हैं, सबसे बातें कर रहे हैं, क्योंकि कोमा के पेशेंट अभी चलने लगे, मतलब इट्स अ मिरेकल फॉर मी।
और ये सेंटर में केयर भी अच्छा है, इसीलिए पेशेंट के लिए पीसफुल लाइफ है।
फिलहाल तो मैं ऐसा आ जा सकता हूँ, अकेला आता हूँ तो अकेला जाता हूँ, इधर आने के बाद ये मैं ठीक हो गया।
After my dialysis, I'm feeling much more better now. I'm being able to walk again, but it is gradually getting better and better. I feel people should go in for dialysis, which is very much good for kidney.
Being on dialysis doesn't mean that the patient has to take all the burden on themselves. It's a teamwork between the patient, between their relatives, the doctor. Everybody has to be helpful around, and the doctors here, they never treat them as patients. They know their household problems. Even all the sisters here, the doctor here, they will tell her, oh, I know that you have to go home early because you have a kid to take care and everything. So it's giving personal attention to everybody. They are also acting on her, boosting her energy.
इंसान को किडनी के बीमारी से दूर रखने के लिए, उनसे उनको मुक्ति देने के लिए और नॉर्मल करने के लिए सिर्फ एक डॉक्टर की ज़रूरत नहीं है, तो एक टीम वर्क की ज़रूरत है। पेशेंट्स तो है ही, उसके साथ उनके नज़दीकी रिश्तेदार जो दिन रात उनकी सेवा में जुड़े रहते हैं। ये टेक्नीशियंस है जो अपना काम बहुत बखूबी से जानते हैं, जिनके टेक्निकल स्किल्स के द्वारा डायलिसिस एक आसान ट्रीटमेंट हो जाती है। डाइटिशियन है जो उन्हें कहते हैं कि उनके क्या खाने पीने की ज़रूरत है, कौन सी चीज़ें वो नहीं खा सकते। सोशल वर्कर है जो उनके सोशल प्रॉब्लम समझ सकते हैं। तो ये जब टीम वर्क होता है तो वो दिन दूर नहीं जब पेशेंट्स पूरी तरह से नॉर्मल रह सकें।
If you are a dialysis patient, you need not just live, you can live and live very well, and Apex will see to it that you achieve that.
I go for work, I use my scooter. I go from Mulund to VT on scooter. I don't feel any tiredness, nothing.
अभी स्टेट एजेंसी का काम करता हूँ, कोई रूम होगा इसका डीलिंग का, वही ज़्यादा करके करता हूँ.
But now, because she is taking a regular dialysis, it is much better for her. She can come home. She can even take care of my son, who is just 1 year. She plays with him. She has got all the energy to play around with him. This is just because she has been on regular dialysis, and her body has been cleaned every weekly as required.
Even she took me sometimes outside. चलो घूमने को चलेंगे. I go to Big Bazaar with her because I have to see also how she will be more comfortable after doing all these things. It's a tedious job little bit. तो उसको अच्छा घुमाना भी पड़ता है ना.
Dialysis works, and high quality dialysis works even better.
In the short term, patient feel better, eat better, think better, and even sleep better.
And in the long term, this person on dialysis is able to go back to work, earn a livelihood, become financially independent, and lead a normal life.
Ultimately, high quality dialysis means much better quality of life for kidney disease patients.
एपेक्स किडनी केयर कंपनी के माध्यम से वैसा सोच रहे हैं कि बॉम्बे के ऑल ओवर बॉम्बे के ज़्यादा से ज़्यादा सबब में हमारा सेंटर खोलने की इच्छा रखते हैं.
My dream is that every Indian, rich or poor, suffering from kidney disease should have access to high quality of treatment.